This is going to go quick.
Good morning. If you'll take your seats, we're going to get started. My name is May Carpenter. I'm Commissioner of the Department of Senior Programs and Services, and welcome to Reimagining a Life with a Purpose and Without Snow. We want to thank all of you for coming this morning, and we're sorry we had to change the venue and the time, but due to the storm and big trees across the parking lots, we had to change the venue to the county center. And we do thank the Osborne for being willing to host this event this morning, but they had their troubles with the storm. I hope all of you got through it okay. Okay, it was really challenging. Back in 2005, at the White House Conference on Aging, we formed a Livable Communities Collaborative. And with that, we put together 97 different resolutions, and we sent them to every county in the country and every senior organization, calling for legislation to start livable communities programs. And we made the top 50. They would only allow 50 resolutions to be passed. We made the top 50, and we made the top 10. And Livable Communities is one of those resolutions. And out of that, with the reauthorization of the Older Americans Act, they started the Livable Communities program, guess what? Without any money. But Westchester being what Westchester is, and that being our resolution, your resolution, we got busy with finding ways to make Westchester more livable. We know that we had the highest out-migration of the 65-plus population than any other county in this country. And we know the struggles of being here with the highest property taxes 3 years in a row in Westchester County. So it was important to work together what we could do to make life livable for seniors so we would not lose that talent, we would not lose those skills, we would not lose those energies, and we would not lose the income with everybody leaving and moving out. So you got started with, you kept going with your collaborative for livable communities, and after that, we divided the county into 9 different regions. And we appointed 9 different regional coordinators. Why don't the regional coordinators for livable communities please stand? Thank you very much. Now they bring together the various communities in their regions to discuss housing and transportation. And if you ever get a chance to go to one of those meetings, you should go. It's very interesting to see communities that didn't collaborate before talking to each other. A few years back, one community said, you won't build community housing in your community, which means that your seniors come to our communities to put their names in the lottery for senior housing. And if they should get in, if they should be selected, they've left their friends behind, they've left their houses of worship behind, they've left so many natural assets behind. So you should build senior housing. Another community told another community, you won't allow that bus to come down that street, which means that our seniors have to carry their groceries up a hill who live in that apartment building. So they get a chance to collaborate and what they could do to make life livable for all seniors in all communities. So with that as a model, and we received the designation as the most age-friendly community in the country from the AARP and the United Nations. We presented our Livable Communities model to the United Nations, and they adopted that as a platform for all other communities to become livable under those standards. And I understand now that New York State is the only livable community state, would you believe, in the union, based upon the Westchester model. I want to thank Colette Phipps, our Executive Director of Livable Communities, and Jennifer and Mary Kay, and all the staff of the Department of Senior Programs and Services for giving so generously of your time to train other counties and to present at national conferences. And this becomes a model for other communities around the country to become livable for senior citizens. I got a chance to present our Livable Communities program at an international Livable Communities conference about 5 years ago. And I told the county executive, if I ever do this again, just shoot me. I tell you, we were supposed to have only 2 people speak. and we had X number of minutes, and countries came in all their country dress. They brought 15 people. They had videos, they had surprises, gifts, everybody there. So we were very pleased to get 2 awards. Let's see, I think Dubai and some other country beat us out. But I mean, they were there in their full regalia and costumes and everything. So I said, if I ever do this again, just shoot me. I told them, I says, well, we're here to share with you what we do in Westchester County. I says, we don't have any glitz, but we do have substance. And they agreed. They gave us 2 awards. So thank you to our Livable Communities collaborators for making what you do available around the world. And we do get calls around the world. They go on our website and ask if they could copy our brochures, if they could start this program, can they have our training manuals, and this is all because of you, because of what you do. So I want to thank you for coming this morning. As I said before, our purpose is to reimagine life with a purpose for seniors here in Westchester County. And you're going to hear more in the future about some innovative programs we have coming up, Senior University, shared housing, and many other creative programming. But at this time, we're waiting for the county executive, if his schedule permits. You know, right now he's dealing with trees across driveways and power outages and internet outages, but he will get here if he's able. He wants to be here. But it's my pleasure to introduce to you Colette Phipps, who is Executive Director of our Livable Communities Program. And you all know Colette. This is the woman with boundless energy. If I get some time off, and I sort of call us the Jay Leno Jaywalkers. Remember Jay Leno Jaywalkers? We're out there walking around when we hear stories, when we see pain, when we hear pain. We get back and try to create a solution if we don't have one. And Colette is responsible for implementing those solutions. So Colette, thank you for all you do, and thank you to your staff.
Well, thank you, May, and good morning to everyone, and welcome. So I guess we've really had our own wrinkle in time, right? It's been wrinkle in time and wrinkle in location. But I want to first start out by thanking May. I am deeply honored and privileged to be able to guide this initiative because I certainly don't lead it. It's all of you. And in the neighborhoods, all those neighborhood block clubs and those regional council meetings and the wonderful LCC connections, and probably the best team in the world, the team that I work with. So I thank you so much. Just one more thanks that I want to give, and that's to the county center, because we really had to turn on a dime in terms of changing venues. And Veronica Schneider and her staff was right here to do it for us. So we want to thank the Westchester County Center. We all work together. So at this time, I would like to bring up Jennifer Crawford. She led this mission, and it's happening, and we're so absolutely proud of her. And so Jennifer, come on up. This is your day.
Thank you so much, everybody. I'll be quick, I promise. So thank you very much to our commissioner and to Colette Phipps, and of course to the County Center for hosting us today. I would also like to extend a very big thank you to our sponsors, our silver sponsors, Empire Blue Cross Blue Shield and MVP Healthcare, and our platinum sponsor, AgeWell New York. It is with these kinds of generous sponsorships that we can bring quality events like this free of charge. I want to thank everybody for being here so much. I was reading something this morning, very early this morning, because I was running through everything in my mind, and I came across this wonderful quote that I wanted to share. And it was, even in the darkness, and I know that there's many people here in Westchester and in the tri-state, in the darkness, there is something beautiful to say, and you are that beauty to me today. It is so wonderful to see you, and I hope that this brings some brightness in your day as well. With that, I'm going to thank and bring up Deb and Louise, 2 of our LCC coordinators, and also our age-friendly co-chairs. Thank you.
Hello, you hearty souls. Oh, I'll say the quick go-around of thank yous as well. Westchester County Center, the staff at Department of Senior Programs and Services, Commissioner Carpenter, our sponsors, and you, the audience, for being here. We briefly just want to let you know that throughout the presentation, you might have questions or comments that you would like to make. There's in your folder an index card, so you can write that down. And Mary Kay's showing. This is the index card. And Mary Kay will be the one collecting the index cards when it's time to do that. So just keep that in mind. And Louise?
We are fortunate, Deb and I, to have a wonderful collaborative, age-friendly collaborative to work with, and I would like all members of the collaborative to stand so we can thank you. Thank you very much. I also want to mention very quickly that I heard today on the radio it's International Women's Day. I know that March is Women's History Month. So I'd like all the women in the audience to stand. Yay. Now, anybody who does not identify as a woman but has a woman or knew a woman who helped them or they love, you stand up. Really, we all, it's a Women's History Month has a lot of literature that you could read about it. The library has books, and that's kind of my thing. So I hope that some of you will read about some very special women or just ponder about the own women, the women in your own life. It's my pleasure to introduce our moderator, Rabbi Michael Goldman. Rabbi Goldman is the founding director of SEVA, Life Beyond Memory, a nonprofit organization devoted to inspiring, organizing, and training volunteers and institutions to help people affected by dementia to live spiritually and emotionally gratifying lives. In addition, he also runs the WJCS senior program at Sinai Free Synagogue in Mount Vernon. Rabbi Goldman has also served as a congregational rabbi and a campus chaplain. So we're going to turn the program over to him, and he will guide us the rest of the way.
Thanks, Louise. Thanks, Deb. Thanks, Colette and May and Jennifer. Just a little story. In my first year or so as the coordinator of this Senior Day program, I looked a little bit at this one group who would come for exercise and then leave. People in their 60s, 70s, 80s, 90s, but all physically fit and ready to go, and they come and go on their own. And I wanted to engage them somehow and get them to stay. So I bought them some snacks and did a focus group and asked them, what would keep you here beyond 11:45 in the morning? And I thought, oh, you know, we could have some singers, we could do a movie, what would be nice for you? And what every single one of them said fell into one of the two categories, and there was much overlap. One was, we want to know more about the world. Bring interesting, engaging, provocative speakers. The other thing that they said was, we want to make a difference. I do a blood drive. Let's do a blood drive. Let's go to a school and read books to children. They wanted to be involved in their communities. They wanted a sense of purpose. And we all are just beginning to absorb, or maybe have absorbed already, that is the new look of getting older in America, is not just to be entertained, not just to be comforted, but to live with full meaning and full engagement in our world. And that, of course, is part of the mission of Livable Communities, that as we age, we seek not only to be amused and to be free from ailment, but we seek meaning. We age with purpose, and that is why we are here, to explore that. And I can't think of three more fitting presenters to really inform us and also inspire and provoke us than the three we have here today. Paula Spann, who is a New York Times columnist, writing the New Old Age and Generation Grandparent column and blog. Carrie Mills, the founding director of Engaging Alzheimer's, and Ruth Rosenberg of WJCS.
Bloom.
Rosenblum, sorry, Ruth. There you are.
Oh,
Yeah,
Bloom.
Who is, among many, many other things, a resident mindfulness instructor and wise aging leader. You can read their bios in full in your packet. I want to say something a little bit more personal, a little more affective, as each one takes the podium. I'll start, of course, with Paula, our keynote speaker today. I spent a good deal of my snow day yesterday really with the delightful exercise of reading Paula's writing on the New York Times website. A whole stack of articles, pattern came into focus. And that pattern is that she has a keen ability to relate the macroscopic, the quantitative data, to the stories of ordinary people living their lives. So just one example, she followed a few intergenerational households, grandchildren, parents, grandparents, and told their stories, both the delights of that close community and the struggles and tensions, and then mined data going all the way back to the 1840 census to look at the arc of numbers of grandparents living with their children, and found some astonishing conclusions. They are from another day, but I hope you go and look. This to me is what good journalism is. It's really the practice of helping us relate our own personal and social experience to the greater world, to understand that we are part of the arc of history, and to be informed and to be inspired and curious about it, and most of all, to use that knowledge as a weather vane for knowing which way we need to face our ship. So with great delight, Paula Spann.
Thank you all. 48 hours ago, I would not have given great odds that any of us would be here or anywhere. So Jennifer and Colette and the County of Westchester have done, to use the technical term, a kick-ass job of the, and the show must go on. So it's just, I'm always happy to be with people who are working in the field and, people in livable communities, age-friendly networkers, professionals. And I also hope you realize how leading edge you are in engaging with this subject, the purposeful life. Because this is not just a buzzword, purpose. This is a subject that gerontologists and psychologists and sociologists have been actively investigating. And it is a very powerful concept. It's also been just a personal interest of mine for several years too, something I've been writing about, thinking about. I think it has implications for us individually as we age, but it also has larger implications for our society too. And yet it frequently gets overlooked when we're talking about the last quarter of our lives. I think intuitively we understand what purpose means. What gives you a reason to get up in the morning? All that care that we take with our health and our well-being, what results from it? What difference does it make? And to whom? Earlier in life, in youth and midlife, I think this roadmap is a lot clearer. We know what we're supposed to do, even if we hit some speed bumps and roadblocks as we go along. Most of us get some level of education. We find work that fulfills us or at least supports us. We form families of various kinds. We engage in communities of various kinds. And then in our later years, the road becomes much less well-defined. Most people stop working at some point, though retirement age is going up for several reasons. Most people's dependent children become independent and leave the nest, eventually. This does happen, trust me. And so what do we do then? And often, traditionally, we're just told, well, now you just relax and enjoy your leisure. And I know that some people do. But for others, like for me, example, age 68, I think, really? Like 20 years of just chilling out? I don't think so. Our life expectancy has lengthened substantially. We are looking at a long period of time in which we have to figure out what do we do with ourselves that makes a difference to anybody else. If I chilled out for 20 years, I would be thinking, what is my purpose? In the research world, psychologists actually have a working definition of purpose, quote, a commitment to broader life goals that helps organize your day-to-day activities. close quote. It's the sense that life has meaning and direction. And researchers can actually measure how much purpose people have. They use these scales, questionnaires, these are well-validated social science tools, and they ask people to respond to statements like these. I feel good when I think of what I have done in the past and what I hope to do in the future. Strongly agree, agree, disagree, strongly disagree. And I sometimes feel as if I have done all there is to do in life. Strongly agree, agree, disagree. And some people wander aimlessly through life, but I am not one of them. A series of statements like this. And then later, when the scientists tabulate the results, they report that having a high level of purpose in later life is a good thing to have on many counts. It's a robust predictor of quality of life. It's associated with feelings of satisfaction and happiness, with better physical functioning, less disability, even with better sleep. A neuropsychologist named Patricia Boyle at Rush University Medical Center in Chicago has been doing a lot of this research. She's been tracking cohorts of older adults living independently in Chicago, testing them at intervals to measure their changes, their physical, psychological, cognitive changes. She's been following 1,000 people for about 10 years. And her team has found that those with high scores of purpose are actually much less likely to develop Alzheimer's disease. Having purpose seems to slow cognitive decline. Older people with purpose were less likely to develop different kind of physical disabilities. They had lower mortality rates. In fact, psychologist at Washington University in St. Louis, his name is Patrick Hill, has found that purpose protects against mortality throughout the life course, not just at older ages. And having written about this a few years ago, I checked back with these researchers, and there's more. Because both of these research teams continue to deliver good news about purpose. And here are some of their more recent findings. People with a stronger sense of purpose were less likely to suffer cerebral infarcts, also known as strokes. They were less likely to be hospitalized for a long list of conditions that can be treated with active outpatient care. So these are preventable hospitalizations for things like asthma, pneumonia, diabetes, hypertension, various kinds of infection. Purpose somehow helps protect against that. And among adults of all ages, purpose has even been found to have financial consequences. So people who reported a greater sense of purpose had higher incomes and net worth, and greater increases in income and net worth over a decade's follow-up. And by the way, having purpose doesn't necessarily depend on having good health, because both of these research teams